1, let's go.
A woman named Donna Hugh and Brown received one of the treatments in psychiatry and lost her 3-year memories. A friend of mine who has schizophrenia lost his cognitive functions. We talked and he forgot what we talked 2 seconds later. And I myself nearly received this treatment if it was not the case that my guardians declined. And my psychiatrist is against it, that he never allows me to undertake it. And this treatment is called electroconvulsive therapy. Today, I'm going to show you what ECT is, why it should be banned from psychiatric treatments, and I'm going to propose to you the better alternative choices available. ECT was invented by 2 Italian neurologists named Ugo Serletti and Luciano Bini in 1938. According to the American Psychiatric Association, ECT induces brief seizures and is believed to alter the chemicals in the brain. But the mechanism is not known yet, and what it makes controversial. And the procedure is here. You put the patients under anesthesia, which means patients are unconscious, and you inject muscle relaxant. You put mouthwash and electrode placement, which can be both sides on one side, and pass electricity to the brain. Some proposed benefits of ECT that it can cause a rapid relief. ECT might provide quick symptom relief for severe mental health illnesses such as severe depression, especially a treatment-resistant bipolar disorder, which involves mania management, where the patient's mood is very high, euphoric, and can be aggressive. Schizophrenia, which involves the hallucinations and delusions, and intense suicidality, which means like patients have a very intense suicidal ideations. According to Taylor in 2017, patients who show no response to medications and talking therapy still show response to ECT at a rate of 55%. However, it has been argued that there are some renowned significant negative effects of ECT. The first one is relapses. Relapse after successful treatment, especially with no intervention like medications, is very high. And it provides only the short-term benefits and not in the long term, because the effects are very low. And the memory loss is very renowned and very common and very significant. For example, like you can have a temporary memory loss, but it takes years to recover. You can have a permanent gaps in memories, or in the worst case, you can have permanent memory loss, like you. According to Taylor again, people who show no response to ECT at a rate of 45%. What does this mean? It means that patients already experience cognitive side effects, but not cured. Now, I'm going to suggest the alternatives to ECT, the better treatments available, which are medication and psychotherapy. The medication, there is development of the medication. Medication are considered to be the first-line treatment for the mental health illnesses. And there are a range of medications, for example, the antidepressant for depression, mood stabilizers for bipolar disorders, anticonvulsants, antipsychotics, benzodiazepines, and much more.
I would like to highlight the example of the effectiveness of the medication for the lithium. Lithium possesses the strongest potential to prevent the suicide for bipolar disorder at a rate of 60% and can prevent the long-term relapse for bipolar disorder. However, like medications come with side effects, but it can be addressed what is called rational polypharmacy when patients take many medications, and psychiatrists will outweigh the side effects for patients to get the patient as less side effects as possible. Now, next is psychotherapy. It is the clinical and interpersonal methods of talking treatments which modify the behaviors, ways of thinking, and emotions. And a number of studies show that a combination of psychotherapy and medications will enhance the outcomes and can be as effective as ECT. Now, to sum up, I'll show you pros and cons of ECT and suggest you the better alternative outcomes, which is the combination of medications and psychotherapy. I still firmly believe that ECT should be banned or at least considered as a last resort for the psychiatric treatment due to its cognitive side effects. And once you receive repetitions required because its effect wearing off, and I'm sure that you don't want to put your loved one in this situation, like my close friend, or in the worst case possible that I've ever seen, like Dr. Hugh, who sacrificed 3-year memory to ECT. Thank you.
Okay.